Hello everyone, I'm Dr. Jude from Hydrate Health, and today we are talking about hair loss, what most people call balding, or what the scientists call alopecia. We're going to look at the hair cycle. We are going to look at the different hair types. We shall also look at the possible causes of alopecia and the possible treatments. We shall look at the routine hair care tips, and we shall see why dark hair turns gray, and we shall also learn why some men can't grow a full beard. So we could start by looking at a hair structure. A hair is not just that small protrusion out of the skin as you see. Hair is a whole structure. It has blood supply, as you can see the capillaries. It has a part called the bulb. Yeah, part of it is called the follicle, and it also has some muscles that help it go straight and relax it. It also has glands that supply it with a special form of oil called sebum. For the different types of hair, we have lanugo hair, we have vellus hair, we have terminal hair, and we have androgenic hair. All these hairs are important in our growth, as we are going to see ahead. So the lanugo hair, this is the hair on the baby, or what most people call a fetus. It helps us to know the age of the baby or the age of the newborn. It's also a source of warmth for the babies. We also have the vellus hair. Now, that very fine hair on your skin. Yes, you can see on your hand, on your face, on your legs. That's what we call the vellus hair. It's fine, thin, and light colored, and it covers majority of the body. It is about 2 millimeters. It's used to regulate the body temperature. It's used for warmth, and among others. We shall continue looking at the functions. Then we also have terminal hair. This is the coarse hair on the various body parts in our adult years. The hair on your head, like mine, the beard is terminal hair, and other coarse hairs on your body. We also saw androgenic hair. Androgenic hair is a form of terminal hair that develops on the human body during and after puberty. Yes, you see some men get beards, some men get chest hair, females get bikini hair, and among others you get armpit hair. So all that is termed as androgenic hair. So the hair cycle, this is quite complicated, but we shall make it as easy as possible. Our hair goes through 3 phases. Yes, it goes through the anagen phase, that is the very first phase, or you call it the actively growing phase in the simplest of terms. Then we also have the catagen phase, which is called the transition phase, and the resting phase, which scientists also call the telogen phase. In these phases, different things happen, and if we are to look at them phase by phase, we shall see that in the anagen phase, or the actively growing phase, this is where the hair follicle or the hair gets nourishment from the blood vessels. This phase, mostly on the head, takes 2 to 6 years. That is a very long period of time, and this interesting fact explains why some people have long hair and others have short hair. So this phase determines the length of hair, and different hairs on our bodies have different anagen stages. Yes, like the ones on the legs and the ones on the hands, the eyebrows, the eyelashes. All those have shorter anagens of about 30 to 45 days. That's why they are shorter than our hair on the head. And you should know that 80 to 90% on the hair on your scalp is going through anagen. Then we go through the catagen phase. This is a transition stage, as we said. Yes, it lasts 2 to 3 weeks. In this phase, growth stops. And then we have the telogen phase. This is the resting phase, and it is the last phase of hair growth. It lasts 2 to 3 months. In this, there is no growth at all. 2 to 3 months is for the hair on the scalp, though for some other hairs, like the ones on the body and your eyebrows, your eyelashes, take a longer time. After this, your hair is released and a new hair is grown. That was a brief introduction about the hair structure and the phases it goes through as it grows. So back to alopecia, or hair loss, or balding. So this could be defined as partial or complete loss of hair from all the body parts where it normally grows. There are very many causes of hair loss. Among others, we have genetics being the main culprit. Genetics, most of the forms of alopecia are associated with or worsened by genetics. So we shall see that stress also causes hair loss. Yeah, the stress being childbirth, surgery, different illnesses. Yeah, losing a loved one, you can also lose hair. We can see malnutrition, exposure to different substances. This could be toxins that could injure your hair, exposure to burns, injuries, some infections also affect hair growth. We have diseases that lead to hair loss. We have certain medications, and we have some therapies. You've heard of radiation therapy and chemotherapy. All these can lead to hair loss or alopecia. So we look at the different types of alopecia. We have alopecia areata. This is an autoimmune condition which causes patchy hair loss. And in this, you'll find that the immune system is attacking the hair follicles by mistake. There are different types of alopecia areata. There is alopecia totalis. Alopecia totalis is an advanced form of alopecia areata, which involves total hair loss on the scalp. We also have alopecia universalis. This is an advanced form of alopecia areata, which involves total loss of body hair, including the eyelashes and the eyebrows. Then we also have alopecia barbae. This forms patches on areas around your beard area. And then we have androgenic alopecia. This is also known as male or female pattern baldness. It's the commonest cause of hair loss. It involves thinning of a hairline to an almost transparent hair in both males and females. We should know it is hereditary. It's linked with having excess male hormones. Yes, and as you can see, we have the male pattern baldness and the female pattern baldness. In women, this androgenic alopecia is most common during menopause, because fewer of the female hormones are in production. So then we also have scarring alopecia. This involves disorders that cause permanent hair loss. Things like burns, deep cuts, and other infections that affect the hair or that affect the bed of the hair, causing wounds that leave scars where hair is not going to be grown anymore. We also have traction alopecia. This is caused by putting stress on hair through repeated pulling or stretching. This is mostly seen in people who plait tight ponytails, buns, dreadlocks, weaves, braids, and among others. Now that we've seen the different types and causes of hair loss, we look at the treatment. Treatment can be broken down to medical management, surgical management, or cosmetic management. For medical management, could always call in Rocket Health to speak with a doctor and get the different options of management. If you want a surgical management, you can always come in to our clinic that is along Lumumba Avenue on Rome Building, and you'll have a doctor speak with you and give you different options. So some of you have been wondering why some men are not capable of growing a full beard like mine. Yes, this can be because of age. A young person cannot grow a beard. It can be because of the genetics. Some people are not able to grow a full beard. It can be because of the different type of alopecia. We talked about alopecia baby, where you have patches in your beard, you'll not have a full beard. It could be your race. Yes, some of you might be wondering why dark hair turns gray. Yes, so we grow with dark hair, and as we age, the hair turns gray. There's a special protein in our body called melanin. As we grow, this protein gets depleted. And if the stores are depleted, our hair will gradually turn gray. Finally, let's look at how we can routinely take care of our hair. For the ladies, we can do scalp massages. We can wash our hair regularly. That's visiting the salon or at home. Hydrate, have a balanced diet. The men can trim their hair oftenly. Wear a cape when it is too hot as you're heading out. Use products that are gentle to your hair. Thank you very much. For more information, please visit our website www.rockethealth.africa or call our toll-free number 0800 277 015. Thank you very much.